Hello and welcome to our Friday webinar with Dr. Tom Tully. Welcome, Tully. Welcome, Dr. Tully.
Hey,
How are you
how you
doing?
doing there, Laura? Good to see you
Good to
again.
see you.
Again.
Ready for some great questions today?
Yes, ma'am.
Ask the vet.
Always. We have a great group. So
All right.
always interesting questions.
Yeah. So while everyone logs on, let me do a screen share because spring's upon us, right? So when you think of spring, you think of showers, right? And all that. Let me see if I can.
Pollen in the air.
That is true. So yeah, seasonal allergies are probably happening.
That's right.
All that pollen in the air. Okay, let me see if I hope this plays right because I'm trying to. Okay, I just want to spread the love of bathing. The birds. Ready for this? I love this so much. This is slow motion. Look at how lovely and happy that cocktail is. Can you see that?
Yes.
I'm gonna play that one more.
Well, you see how those eyes are. It's like they're in a zone.
Yes.
It's like look at that.
I'm sure there's music with this, but I couldn't get to play. But oh my gosh, I mean, it's just season. Yeah, that's the happy bird, right?
I'm telling you.
Plus, you're kind of, taking away all that dust and dander that he's just spraying it off. So yeah, I'm one more time. I just love this. Look how happy that heel is.
And then you look, like I said, look at those eyes, and it's like, you can just tell. No, that's great. That's a little missing. Yeah.
It's a spray bath for you, right? That's
right. That's right.
So,
Well, very good.
yes. Okay, let's see here. Let's see if so just a reminder, gosh, we're gonna take some questions, and if you have a question, use the Q&A button and not the chat feature. And yeah. Oh, so hey, so since we're talking about pollen in the air, I mean, birds, they can get allergies, right? Can they get spring allergies? Can they have allergic reactions to pollen in the air?
Yes, it's one of those things that I was just talking to an owner, I believe it was yesterday or the day before, and there was some issues where there was like the bird appeared to be itching quite a bit in certain areas, and then the nasal, the nares, the nostrils were a little bit inflamed, little and seemed to be bothersome in certain particular areas that the bird was just seemed to be focused on and had its attention. And I've seen birds where there's normal grooming behavior, and then it seems like the bird is just grooming excessively, like something's bothering it. And and so we mentioned, you go through and you take diagnostic, look at diagnostic tests, you see if there's anything that's abnormal when you are examining the bird, and go through the history and try to kind of correlate that out into what the possibilities are, and also what diagnostic tests that would be best to try to determine what's in fact happening with the bird, that's the underlying cause of this kind of excessive aggressive picking behavior. And if you have really not a lot of positive results come back, or everything is what we consider negative or within normal limits or range, then there is the possibility that there is some type of hypersensitivity. I call it an allergic reaction, a hypersensitivity. It can be a little bit worse or more worse than just kind of excessive grooming or some feather destructive behavior, or not so much, just like this bird, it's itching. The owner, that's the way the owner described it, or having excessive kind of aggressive grooming. So you can have a range of that, And in general, I believe so. That this is the case, that birds can have hypersensitivity reactions, allergic reactions to something they ingest, something within the environment. Really no different than any other animal. No different than any other animal. It's not like, well, birds are special. They don't have their immune system works differently, and they don't have peanut allergies. It's like, I'm not saying that we have a bird with a peanut allergy, but I'm saying like they just don't have allergic reactions. And there is evidence that they do have this through both immunological studies, type 1, type 2, type 3, type 4 hypersensitivities, and all that entails. And then we have actually had birds, when you're talking about the pollen, that have had birds that have actually been presented to the hospital and clinic almost the same week every year with issues. And I can remember one in particular in November. It was always in the first couple of weeks in November, and I don't know what was happening here within the environment the first couple of weeks in November, but that bird every year would come in with a dermatological feather destructive behavior at that time of year. And so, yes, the short answer to your question is yes, they can, in my opinion, based on the evidence from both clinical observation over the years. We have done really here at LSU, we've had investigations that have looked at dermal skin testing. We looked at actually doing dermal skin testing in birds to do a skin test like they do in humans. What are you allergic to? You're allergic to grass, dust mites, pollen of all, And so we said, well, let's try to do this in birds. Unfortunately, birds don't have large areas to do these skin tests on, but we did find that there were reactions that we were able to get from known irritants and versus non-known irritants. So it's not possible to necessarily do a skin test, but through that research, we did quite a bit. Also brought it out where people discussed it and said, because there was a question, do birds get hypersensitivities? Although we've had vaccine reactions with birds. And so that kind of, the general thought is that they do. And there you go.
Wow, that is fascinating.
A little bit of information there, but it kind of dovetails into one of the most common problems that people have with their companion birds is feather destructive behavior. And that is not the only, just like anything else, it's multifactorial, but that is one issue that one needs to consider, whether it's an ingested possible hypersensitivity that they would have or something within the environment in that manner. So there you go.
Thank you for that. That was awesome.
That was a good question.
Well, I thank you so much. No Allegra for your. Just kidding.
Yeah.
Okay, so we have a question about a budgie. 3-year-old budgie has been vomiting intermittently for the past 2 years. So apart from infections, she's had cases of unexplained vomiting episodes. For example, February of 2022, she was found to have an enlarged liver and proventriculus. So a few weeks ago, she started having a major episode of vomiting plus seeds in her poop. And her weight dropped, this is a budgie, from 32 grams to 24 grams in a week.
Mhm.
So now the doctor is suspecting PDD, suggesting to start with Celebrex, and they believe she has an AGV in her, as her symptoms fit that, and they start on a CV and pellet diet. So what can they do to make her life better? They said that she seems kind of too weak to do further testing. So
Yeah. There's, that gets to the, and then you also like, what other tests can I do that will give me reasonable results, let's just say, that would be useful. When you're looking at, is it something that's going to dictate or give me information toward a treatment plan? Is it going to help me say, oh, that's what it is, and we can't really do anything, but we can make the life better? So those are all factors that can happen that you're looking at as far as diagnostic testing. And obviously with her general condition, or the little bird's general condition now, that's not possible. So I would say that I haven't, and I'm not saying it's not, I'm sure that there are people out there that say, oh, well, we've had birds with PDD in budgies. And I always like to bring back what Dr. Branson Ritchie always said. There's a lot of things that could cause a dilated, proventriculus, a number of different diseases, conditions that can cause it, but only one is PDD. So, that doesn't, just because it's dilated doesn't mean it's PDD. But it's hard to determine exactly what it is because you can't do any more diagnostic testing. And so you have a budgie and you think about regurgitation. I would say with regurgitation, you look at ingluvitis, and that's just inflammation. Ingluvitis, ingluves is the crop. I may have mentioned that before, but that's the terminology. The medical term for the crop is ingluves, and ingluvitis is just like cropitis. It's just inflammation of the crop. Now, what can cause inflammation of the crop is a bacterial infection, and that is best identified through culture, or the very least cytology, but you don't, you can identify that there's a car there, but you can't tell if it's a Honda or a Ford or a Chevy or a Nissan. So you can tell there's that there are bacteria there, but you can't identify those bacteria. So it kind of hinders your ability to for treatment, but you can kind of treat toward what those bacteria may be, or even see that there are candida that would be involved in that. Now, regurgitation, as I mentioned, it can be a bacterial infection. Behavior in budgies. Now, budgies will regurgitate and kind of throw, kind of vomission, if you will, through just behavior, amorous behavior. And then, they may look at themselves. If there's a mirror or another budgie in there, they may regurgitate. However, you mentioned that there's full seed in the stool, and so that means that maybe there's something going on in the gastrointestinal tract, because budgie stool, normal budgie stool, nobody can say, what does normal budgie stool look like? It's black with a white dot. Okay. It's like, so so that's normal. So budgie stool shouldn't have any seed in it. So that would be akin to possible diarrhea that the bird may have. or at least just gastrointestinal or kind of a GI dysfunction. But so that is what you're looking at is as I said, a bacterial or infectious, which could have candida involved, and that sometimes goes into sour crop, what they kind of a crop stasis, but it doesn't appear to be doing that. And then you have behavior. Then also another thing that it is what cause regurgitation in birds is kind of heavy metal toxicosis, zinc toxicity. So the only way that the budgie would be ingesting zinc is if it was in the water, and it was actually drinking water and having, too much zinc, because zinc is a normal mineral that we all intake. Zinc prevents colds or whatever, but too much of it, so they can metabolize zinc, but too much of it can cause them to regurgitate. And we see birds that come in that have swallowed a piece of a metal toy, or have ingested something like a penny. Birds that have ingested a penny, not necessarily a parrot, but we have had many ducks come in that have ingested pennies that are minted after 1982 that are 99.9% zinc and just coated with a little copper. So that is all zinc. And so that's in the GI tract, and that can cause regurgitation, among other things. And so this is another, and the last thing that I'm going to mention here is avian gastric yeast. And that's also Macrorhabdus ornithogaster. Okay, I have to think about that. It's a Macrorhabdus ornithogaster. It's avian gastric yeast, and this is not uncommon in budgies, and this will affect their GI tract. Birds can live with this for a period of time. It lives primarily where it really likes is between the gizzard and the stomach. Okay, the true stomach or proventriculus. It likes that area, but it can be throughout the GI tract. And this can cause birds to regurgitate, have diarrhea, and go light. And so this is a kind of a common terminology about losing weight, the birds going light. And so, and it's not that easy to identify through regular means. You can try to get a crop swab. You can try to get a cloacal swab, or a combination starting with the crop, ending in the cloaca, fecal swab, and try to do a gram stain on that. Again, like you said, the bird's kind of weak, and I think that just supportive care would be helpful. And I see that the bird is on some kind of medication. I think it was ACY or something like that. But in any event, that kind of gives you an idea of budgies. Many people, I have 3 budgies. I love budgies, but regurgitation gives you kind of an idea of what's involved with regurgitation, some of the different things that affect the bird, and the diversity from zinc toxicosis to just generalized bacterial infections to avian gastric yeast, and a possible of proventricular dilatation. Again, I haven't diagnosed that in a budgie, possibly others have, but I normally do not see regurgitation with that. But it's, medicine is, there's always something new. Yeah, but I hope that helps with the question there.
All right. Next question is from Frank. Wants to know, do aviator harnesses present any dangers, like to an Amazon parrot, for example, other than training them to wear it, which can be a challenge?
And I would guess this is just like the harness, just to have kind of a leash on that the bird would be able to, that it goes over the bird, and then you clip on the leash in the middle of that harness. And then on some of these harnesses, they have little areas that you can put a little paper towel as like a diaper on that. I guess that's what
Those are the flight suits. Yeah.
yeah, flight suit. Yeah. No, I that's one of my recommendations. That's one of my recommendations, as far as if people say, I don't want the bird to fly. If they come in for the feather trim on the wings, to restrict flight. And I always say, well, we're not looking to prevent flight here. We need the bird to have some lift. We don't want it to drop like a rock. And so this is how many feathers we're going to trim on both wings. We're going to be a symmetrical trim, but it's going to also have lift, so it's not preventing flight. And so there's only two ways to prevent the flight. One we don't want to do, which is amputation. We can guarantee the bird will not fly, but or on parrots to surgically pinion those birds, to remove those digits and carpal bones there on the distal wing, where the primary feathers are. So we don't do that. But the second, which is recommended if you want to take the bird out and you don't want it to fly and maintain control, is a flight suit. So it's training the birds to adapt and to wear it. And that is easier, I believe, when they're younger. That's been my experience. It's not to say that an older bird will say, hey, where's this been all my life? Let me look. I look great, But in general, it would be, to me, the challenges would be more with older birds than younger birds. But no, they're great. I just recommend to make sure that it ties into a ring on the chest, or the pectoral area of the chest. Yeah.
Okay. And just as a follow-up, so like, let's say the bird's like a challenge they mentioned, is there a point of like no return, like where you should probably, like if the bird's getting really stressed out about if it's not accustomed to a harness, like what would be signs of severe, like, can you send your bird into a stressful episode?
Yeah. That it reminds me back in the old days, and this is like this goes along with the question: is there a point of where it's take it off, stop it, stop the training, kind of like an eject button. And so it reminds me of a blue and gold macaw, when we used to put in the last century, we used to put the kind of the disc around the birds' necks. And so it was a blue and gold macaw, and knew the owner, and it was coming in, it had surgery, or it was traumatizing. And I said, we need to keep this on to prevent the bird from getting to it. And he said, that bird's going to get it off. And I said, well, we'll see. I believe, if it does, then we'll go to plan B. And sure enough, I bet about 5-10 minutes, he comes back in and he said, see, told you so. So I said, well, I said, we had a plan B. And you can either do it the easy way or you could do it the hard way. So I said, I'm going to do something with this collar that the bird's not going to be able to get it off. And he said, yeah, well, we'll see. And so what I did is I taped it in elasticon, which is elasticon's a tape that is it's elastic. And if you press on that tape, like if it bites it, it makes it stick more, actually. And so about, that bird was determined to get it off, but it couldn't. And so it's just like this, when the time is, when is it time to call it quits? The owner brought that bird back and I had to cut off that collar, but, and everything, worked out, but he couldn't get it off. And he wasn't going to stop until he killed himself, right? Mm-hmm. And so what I would say is that you want to, again, this is a great example of when you can use your operant conditioning, okay, and training. So if the bird puts the, if you're able to wear, this is anything you want to do and try to have your bird learn something or do something, and that's even like giving medication. If you really, you don't want to ever give medication to the bird, but you can start training the bird early to take oral medication with a syringe by just putting a water or juice or something in a syringe and giving it to the syringe, saying, here, take this, or come here, look at this, and then giving it the treat afterwards, reward. And so you just train the bird. So because we all get sick, have to take medication, when eventually that it may have to have some oral medication, you can just give it and it'll come up to the cage and take it. The same way with the flight suit. When you put it on, say, oh, with a very positive tone in the voice and, oh, that's very good, and give it a treat. And so every time that it puts on the flight suit, then the bird gets a treat. All right. And train it from there. And if it doesn't keep the flight suit on, you don't want to give it a treat. And of course, these are the treats, like I said, that you give only when the bird is doing something as a reward. You don't give these any other time, and the bird loves them. One of the things that I saw that were made specifically as treats at the Parrot Festival in Houston in January were little slivers, little almond slivers. And they were made specifically as a reward. And to give that as something like that, you're not giving many, but I know that my Derby and Parrot, it would go to the almonds first thing. It would get a couple a week, but out of all of the seeds in the seed bowl, that was number one. So if I had to think about what I was going to use as a treat, it would only have got those as a reward. So, that's a good question. And you do not want the bird to struggle and hurt itself. And if it is doing that, then it's time to kind of take it off and start over and go slower and try to use the rewards while that bird puts it, kind of goes through that process. It's a process. A training is a process for anything, for athletes, for people working and having birds. It's a process. We all learn, still learning. Yeah.
All right. This next question, I don't know if you've had this before, but I'm dying to know the answer to this. Okay. A question about 22-year-old rescued cockatiel with feather loss on his head and neck. So they want to take their birds outside in their travel cage now that the weather's getting warm. Do birds with feather loss require sunscreen? And can birds get sunburn?
Yes. I would say yes, they can. We don't see it because they're covered, and birds are relatively smart in the fact that that they stay in the shade and they're not out in the sun, because if it is too warm, and then in the winter you don't have the direct sun as much because it's at a lower angle. But I haven't treated a bird that has sunburn, but there's nothing that I would say that would just physiologically, and I do not believe that there's any reason that they wouldn't get would have sunburn. If you had a bird that didn't have any feathers and you put it in the sun, I think that there would be injury to the skin with that. That's just my thoughts, and so I would and then with the feathers, you just don't see it, and birds are moving and not in the sun all the time. But some are, but those feathers protect them for the most part. Yeah. And
In the
so I would
sunscreen?
say that there would be some injury that would occur on that. But that's just my opinion on the medical, because I don't know if there's anything been really studied on that. And that's a great question. Of course, I wouldn't expect anything less from any of the attendees of this webinar, but I like it. But no, I would think so.
So the sunscreen part, like I imagine, like, if there's the spray sunscreen, there's the if
Nah,
any of that's
I
okay.
wouldn't put any. No, that would just look. It's there is some feather loss in that area, but we don't want to make it any worse. So I would say stay away from the sunscreen and try to limit the time out there. I don't think that I think that an exposure to the sun, that's where I would go with it. But I would not put any type of product on that bird other than water.
Okay. And that might be a reminder that if you're putting sunscreen on yourself and you got it in your hands, maybe rub it off before you pet your bird.
Yes. That's very good. Very good. Thank you. Not only for the contents that the bird would pick up, just like oil spills. It's not only what the topical aspect and what it does to the feathers, but it's also the exposure through ingestion, due to trying to preen that off of them that is ingested. So a lot of that, so that could occur too.
And then the aerosol sunscreen would be.
Oh yeah. Oh yeah.
So, no bueno for the bird. Okay.
Oh yeah. You're very good. Very good.
Well,
But
I'm fair skin, so
question.
I'm
Thank
very
you.
involved with sunscreen.
Well, it's good
Yeah.
for us. I mean, that's the one, that's what we need.
All right, so we have a question from Susan. They have another budgie question. Little budgie with might have maybe a broken wing. So he can raise it up, but he can't open it out from the flight feathers down. It's hanging some from where the flight feathers start. If it is fixed, will he be able to fly again? So he's got a wing issue going on.
Yeah. Well, the first, and this is again another good question, but this, first of all, it does sound like there's a fracture based on the wing hanging down. Okay, just with the history. Now, it's similar to a little quail that I saw yesterday, that had a leg that was it hasn't been using for 8 months, and so it's a very good little quail. But the leg deviated. Instead of being straight. Here you have your both legs. Well, it went in and it wasn't using it, and it had been that way for about 8 months. Otherwise, it was doing well. Um, and with that, the just feeling it, it felt like there was a fracture at the end of the big bone at the top of the leg, the femur. It felt like there was a fracture there that had healed wrong. But I told the owner, I said, well, this is what it feels like, but we'll need to have radiographs, x-rays taken to determine if that's it or if there's something else. And with the x-rays, when we got those, it was not fractured and healed wrong. I was incorrect in my assessment at first on that, and it was more toward the hip area, but nonetheless, it's used. We think it sounds like a fracture, possibly of the big bone in the wing, the humerus, but we need to take radiographs to assess that properly and to try to determine exactly what's wrong with it. Now, it's a budgie, and it weighs, again, anywhere. It could be a small budgie at 25 grams or maybe one larger into the 40s. But nonetheless, let's just say it weighs 35 grams. That's not a lot to work with to try and stabilize that fracture. And a lot of fractures, they just break right in the middle, and so that's hard to stabilize them, because you have to stabilize a fracture from bending. So you say, well, we'll put a pin in it. Well, you put a pin in it, and then there's rotation that occurs. So you have to stop it from rotating, and you have to stop it from bending. Okay. So you put a pin in it. Well, a pin will stop it from bending, but it won't prevent rotation. So you have to stop it from rotation. So sometimes when that happens, we can put a pin in it, stop it from bending, and then we can put a bandage on it and stop and keep it from rotating, and then that works. But in a budgie at 35 grams, that is a very small bone, so you need a very small pin, surgical pin. Not a like a straight pin. That would probably be maybe a size we would be talking about, but it would be very difficult to heal. And most of the time, it won't, not necessarily heal, but to what we would call it a fracture, reduce the fracture back to its normal position. And so it would be very difficult to do that and get what we would call apposition of those bone fragments together. So I would say that in general, if you did have healing, we could not guarantee by any means that there would be flight, and often with the healing on those, that it would be in the fixation. It takes probably 4 to 5 weeks for a good stabilized fracture repair to happen. But to try to determine the method and how well, because sometimes these fractures can splinter because birds have a lot of calcium in their bone. They're very light. They have high tensile strength. So you have often you have shattering of bird bones because they are so strong, have a lot of calcium, highly mineralized, and these shatter, and it's a lot more difficult to fix a shattered bone with many pieces than just 2 pieces. What we call the proximal and the caudal or distal fragment. Yeah.
Wow. I'm just imagining like little toothpick sized bones that you're.
Yes, ma'am. And they look a lot bigger in radiographs than they are in reality too. So the pictures are bigger, but that's the first thing that needs to be done to just assess it. I might add, because I've had a question about this recently. Sometimes these wing fractures in parrots are very severe, and it's not possible. I mean, it would be very difficult to treat those and stabilize those, and we have to amputate the wing. Okay, and a common site of amputation is the humerus, right, the bone from the shoulder to the elbow, right in the middle, because you have muscle that you can oversew that bone and provide cushion. And I would say that if that ever happens, and hopefully that doesn't, but if you have to do that and make that decision because of a severe injury to that wing, that the parrots that we have performed that on in the many years that I've been in practice have really done well with the wing amputation. For the most part, you can't even see where the wing amputation has occurred. The feathers cover it. It doesn't have the extension of the feathers in the toward the tail. But in general, the birds have done well, and the owners have been very pleased with those results. A difficult decision in a time of severe trauma, but that is the method that is and recommendation. But sometimes it's difficult to understand. But if some of our attendees, or they hear that, well, that somebody asked them about, well, there's wing amputation, I really, how's it the bird gonna do, how will it do after the amputation? In general, they do very, very well. And most owners, it exceeds their expectations on that.
Okay. All right. Question from Heidi about Amazon. Amazon droppings have been heavy on the urates, mostly unformed. So is that an indicator that anything is off? Just a little background. She eats Higgins warm grain mix with veggies in the morning and rowdy bush pellets as a stable diet. So is that normal?
No, yeah, that's a good question. I don't think we get bad ones at all, but as far as the urate concentration is concerned, that is something that in general I feel is inconsistent as far as what you see other than in a budgie stool. It's always the white spot, right? But for larger parrots, there may be a little bit more, there may be a little bit less at a certain time. That is that if the bird's eating well, normal consistency, I would say that that this would be just part of a normal variation in the stool. But it is fantastic that that owner knows what that bird's stool looks like, both urine component and the fecal component, because that is one way to just cleaning the cage as an environment gives you an idea on that parameter what you know is normal and what to look for is abnormal. Like if the color changes, then always think about what the bird has been eating, and because it's what if it's been eating something that would color the stool differently, and sometimes some even some of the commercial pellets, they'll get some of that food coloring, and that would change the color or make the stool that color. And they, because they eat those, that's what their normal stool color is. So always consider that as far as the coloration of the fecal material. The urate portion, the whitish coloration, that is again, like I said, it can be inconsistent just due to what the bird's been eating or just physiologically on how that is. And of course, if there's any change in volume, how much the bird's drinking versus how much the bird is urinating, now that can be an issue. But this goes back to when you get your annual exams on the bird, or if you're looking, you're saying, oh, well, I'm kind of concerned. I heard what Dr. Tully said on the Ask the Vet, but I want to get some, CBC chemistry panel, just get check and see. By all means, do that. This is just kind of a question and answer and discussion. And so if there's any concern, to do that, because I'm just kind of basing this on the question and not seeing the bird and what have you. So always take that into account. I'm going to give you my thoughts, but if you want to make sure, then take it in and see what's going on inside. And the best way to do that, as we've always talked about, is getting the blood. Yeah.
Bloods were all roads lead back.
Yes, complete blood count and plasma biochemistry panel. Yeah. So you can see what the uric acid levels is, and see the also the glucose levels and yeah.
All right. So then Barbara, 2 questions for you from Barbara. So they have a 32-year-old umbrella cockatoo with prolapse, has spit up white mucus at times. What does that signify? Do you want to tackle that question first, and then I'll throw the second one out? Yeah. So it's a 32-year-old umbrella cockatoo with prolapse that has spit up white mucus at times.
Okay. Well, the prolapse, if it's
Is it related? If it's
I don't believe it's related. The prolapse, of course, most of the time it's a hormonal issue in these cockatoos. There's many different things that can cause a prolapse, but hormonal underlying cause is probably the most common at this point in history. As far as the let's just say regurgitating white mucus, it's kind of not something that normally occurs, in the birds, and it would, what I would say, I don't have anything in particular that I would say, oh, it's doing that. This is what it is. Sometimes I get, we'll get questions. I'll say, this is what you're looking at. It's variable. I do not see that occur. Often I do not believe they're connected on this. And like I said, behavior for the prolapse, it could be, I don't know where this cockatoo came from. But this is something like, we get these like, well, we have, and you could just as well bring it into the clinic, and this would be the presenting complaint: prolapse, and it's white mucus, spitting up white mucus. And so here I am, I'm in the room, and we get a question. We want to know what it's been eating, when this happens, how often it happens, prolapse, how long ago, what have you. So we have to get this whole history just to give us an idea of how this relates to the condition, and if there's anything within the history that may indicate what's going on. And I may have mentioned this. This is a good example. Have an owner bring in a duck. I mean, it can't walk during the history. And so you go like, so I go like, well, you're looking at a duck that can't walk. And it's looking at you like, hey, I'm fine, but I'm just not walking. So what could cause that to happen? And it's just like this. And so we're going through the history, and I'm going, well, what do you feed the duck? And the gentleman said, cat food. And that's kind of like, well, that's unusual, feeding the duck cat food. And I'm saying to myself, you really don't have to go to veterinary school for this. Well, that may be part of the problem, or the problem, right? There may be something too much or not enough in cat food. But guess what? The duck liked cat food. Guess how many cats the gentleman had? None. How many ducks did he have? 2. So why cat food? Well, they ate cat food. They liked it. And it was easy to buy. He didn't have to go look for duck food.
Wow. Because
the duck food was cat food. So the point is that it was the cat food. It was some kind of a nutritional deficiency. We had that little duck, and it was a 2-year-old duck. It wasn't like a little baby duckling. But the next thing, we gave it nutritional support, Lafeber MRA, and we got it on duck food, and the duck walked. Okay. It wasn't a magic. It wasn't a miracle. It was just giving it the proper nutrition. But just saying, well, why isn't this duck walking? There are many different things that can cause it, but the history, like with what you're saying, why is this doing this? A history is going to be very important. And so that's why I'm saying, you can look at parasites that cause this, and the parasite could cause it going from both the distal end, or the back end, the rear, the cloaca, and it could affect things coming out the oral cavity. So that's one thing you look at. But it doesn't have to be related. But that the spitting up the mucus would have to be investigated a little bit. And always, like I said, you have to see what's going on inside the bird. Is there actually the blood reacting in any number of those parameters to what's occurring? Is this much of a problem, or is it not a problem? because that is something that you look at. You even have, when some of the times where you have regurgitation, clear fluid, tumor, it could be proventricular adenocarcinoma. I'm not saying that's what it is, but I'm just kind of giving and you can also look at it as some type of a normal variation of that animal's behavior.
Wow.
So it's a good question, but it's you have a number of different areas that you can go into with that. Yeah.
Okay. So second part of that question is unrelated. Wow, they got some old 43-year-old Red Lord Amazon has arthritis/gout. So they've given him glucosamine and in a herbal arthritis formula, which seems to help. What else can they do to give him to help him be more comfortable? They noticed that he seems to like climbing up the side of his cage with the horizontal bars more than standing in one place. So arthritic/gout. What can you do?
Yeah. Well, one of the things that with gout, it's not necessarily, and I'm gonna say that there's two forms of gout. There's articular gout, which is the gout within the joints, and that's articular gout, like arthritis, joint inflammation, articular gout. And then you said that this bird had arthritic conditions, right? It was like a 43-year-old
Amazon, yeah.
Yeah.
So glucosamine,
Old man or old woman, huh?
yeah, glucosamine seems to help.
Does the glucosamine appear to help?
Yeah, that in a herbal arthritis formula. So I think it's a food that it
Yeah,
contains
an
glucosamine.
herbal arthritis formula. Well, and I'm giving I'm just thinking based on this that it's been diagnosed with gout through a means to identify the uric acid crystals within the joint. So if that's the case, and it is in fact articular gout, then one treatment that should be, you may want to consider, but there's no scientific basis that glucosamine is going to be effective in birds. But as you probably have given this for some time, that it's not going to hurt. It kind of goes back to the probiotic. It's not going to hurt, so it may do good. If you feel like the bird is responding in a positive way, then that's good. Just like with my suggestion for, and of course, there's no evidence that the herbal works, but I'm not saying it's not going to do any harm, but that's something that you have to just monitor the bird with. And if it's been given with somebody's knowledge of avian medicine and or just using herbal medications on birds, then that's what I would make sure to recommend. And then there's allopurinol. You can use, that's been used for articular gout. I have not used that very much because there's been no real evidence either that that's effective in birds. It's not going to dissolve the crystals. That's what humans take for articular gout or gout, and to reduce the production of those crystals. And so it's more of a preventive, and so you can do that. Also, there's anti-inflammatory medication that can be used as needed. I wouldn't say use that every day, but if your bird, the allopurinol is effective in really reducing the amount of uric acid buildup, then in the joints, then then you wouldn't have to hopefully use the anti-inflammatory NSAIDs like meloxicam, or people have been using Onsior, robenacoxib, that use it as needed. Like, you have a headache. Well, I don't want a headache, so I'm just gonna take Advil or Tylenol every day, just so as to prevent my headaches from occurring. But you take it as needed, and that's something that you would look at doing here. And like I said, the allopurinol, it hasn't been proven that it's effective in reducing the gout formation, articular gout formation in birds, but there are veterinarians that have used this in birds, and they think that then their thoughts are is that they have seen treatment benefit from that.
All right. That was our final question for today. That was
Already? We just
already, gosh, yeah, I know. It's yeah, we kind of we blew through the hour, as so to speak. So again, great questions, right? I love these questions that just
A+. I
anything else.
think it's A+. I mean, there's no doubt about it. Sunscreen,
I
sunburn.
know, I love that question because I'm
talking about that. I mean, they're throwing them left and right. I just thank you all attendees. Great
yes.
question.
And so let's see if we didn't get to your question today, we'll try to shoot an email, or maybe we'll cover it in depth next. We'll be back with you again for another episode of Ask the Vet next month, right? So that and then just a preview for next Friday, we're going to be on with Lisa Bono, and she's going to give us a recap of the Phoenix Landing Wellness Retreat that was back April 6th and 7th. We did a webinar on that one to promo it, and now we're going to do a webinar, circle back, and she's going to give us the lowdown on what went down with all the avian experts that attended that, and so that should be an interesting recap. So got to join us next Friday. Oh, and I got to announce today's giveaway winner, because we always
yes because
we love to
we
give away
appreciate all of those great thank yous.
Oh my gosh, we got so many thank yous.
Yes, so who's the winner?
Yeah, all right. So the winner is, well, you're the winner, Dr. Nice. Our audience is the winner because they got all
so audience is the winner. That's right.
All right. So today's giveaway winner is going to Eileen Payne. Congratulations, Eileen. And what are we giving you? We're going to send out some tropical fruit Nutriberries and another product of your bird's choosing. So hopefully that makes your weekend. Yeah. So all right, guys. Till next time, everyone have a wonderful weekend. All the best to your flock. Stay safe, and we'll see you again, Dr. Tully, next month.
Thank you, Laura. Thank you. Thank you, everybody. Bye-bye.
All right, guys. Bye.